My name is Richard. I'm actually a physician from Victoria, Canada. I am post-op day 6 now from my second operation. I had my first operation 4.5 years ago, and that's when I first learned about ONZ. I had developed degenerative disease of the spine, going back about maybe 10 years before that. Partial paralysis of my left leg with S1 and L4-5 extrusion. So I kind of suffered along with that, and I'd had a posterior procedure in the past, which produced really good results for about a month. And then the symptoms came back again. So I was looking for something more permanent, and I learned more about the artificial discs. And in part because that technology wasn't available in Canada at the time. And then I found out about ONZ and then looked into that. And the reviews were very good. And I thought that they were offering a wide spectrum of options for patients, which I was attracted to. I had my first conversation with Dr. Berstad, who's done both of my surgeries. He said, frankly, when I go into a patient's spine and I'm operating, I never know in advance which artificial disc I'm going to choose, because I can't tell which ones are going to fit better until I find out what the space and the angle is, and not all brands make the same. So your body picks the artificial disc. I don't. I pick what you seem to fit the best, whereas some centers, you're going to get this disc because that's what we put in here. So that attracted me, that there was a more objective approach to it. As a physician, that attracted me, that this person was trustworthy. And you just talk to him for 5 minutes and you trust him. You're going to get what's best for you, and with a minimum risk of complications, because every operation has an inherent risk. And as a physician looking for another physician as a surgeon, we're going to ask them, how have you done this before? How many patients have you operated on? Now, I think he told me, if I'm wrong, he's actually done over 6,000 procedures himself. The more somebody operates, the better they get, and their complication rate drops. And that's what you want. So you're paying for accessibility, you're paying for diversity of options, and you're paying for an incredible experience. And unfortunately for us in Canada right now, the wait lists are just horrific. Don't let yourself get deconditioned while you're waiting for surgery is another really key thing.